Okay, the next item of business is a members' business debate on motion 17073 in the name of Emma Harper on World Asthma Day 2025. The debate will be concluded without any questions being put. I'd encourage members wishing to participate to press the request to speak buttons, and I invite Emma Harper to open the debate. Around 7 minutes. Ms Harper.
Thank you, Presiding Officer, and thank you to colleagues for signing my motion, which allows us to bring World Asthma Day to Chamber today. I'd like to thank Asthma Lung UK Scotland for all the work that they do as Secretariat of the Lung Health Cross-Party Group, which I co-convene with colleague Alexander Stewart, and thank Asthma Lung UK Scotland for the briefing ahead of the debate today, and Chest Heart Stroke Scotland for its briefing also. Asthma Lung UK Scotland have campaigned and advocated for and made great efforts which are crucial in driving improvements in asthma care. And as we approach World Asthma Day, which is May the 6th this year, it is important to reflect on the progress that has been made and the challenges that remain in asthma care. This year's theme from the Global Initiative for Asthma, GINA, is Make Inhaled Treatments Accessible for All. This theme emphasises the need to ensure that everyone, regardless of their global location or socio-economic status, has access to inhaled medications that they need for both controlling the underlying disease and treating asthma attacks. This is one of the reasons why the right inhaler and the right inhaler technique is part of the advice for treatment, but I'm going to come to that, Presiding Officer. Asthma is a pervasive condition that affects approximately 360,000 people in Scotland, including 72,000 children. Although it was interesting to read about the recent BMJ study, estimating that prevalence in Scotland could be as much as 720,000. Asthma is the most common respiratory condition impacting individuals of all ages, and its management requires a comprehensive and coordinated approach. And as I'm still a nurse, Presiding Officer, with a sister who she was a respiratory nurse consultant in her time in the NHS, I recognise the critical importance of providing the basic elements of asthma care. These elements are an annual asthma review, inhaler technique check and a written asthma action plan. These elements empower individuals to manage their condition effectively. Asthma Lung UK reported that 30% of people in 2025 received all three of these essential components. This is an increase from 24% in 2024, which was stated in my motion, so it's good to see that the number is increasing. The 30% figure highlights the need for concerted efforts to improve the delivery and accessibility of basic asthma care. I know a number of the clinicians involved in taking forward the lung health improvement work, where Dundee's Dr Tom Farden led the creation of the Respiratory Care Action Plan, and this work is now being delivered by the Centre for Sustainable Delivery. In November 2024, significant strides were made with the launch of the new asthma guidelines by NICE, which is the National Institute for Health and Care Excellence, and the British Thoracic Society, BTS, and the Scottish Intercollegiate Guidelines Network, known as SIGN. These guidelines are a collaborative effort to update best practice in asthma management. The key aspects of the new asthma pathway include diagnosis. The pathway provides recommendations for initial clinical assessments and objective tests for diagnosing asthma in adults, young people and children. Testing recommendations includes FeNO, or fractional exhaled nitric oxide. FeNO is used to support the diagnosis and management of asthma by measuring nitric oxide levels in exhaled breath. Elevated FeNO levels can indicate airway inflammation, a hallmark of asthma, and then help guide treatment decisions. Monitoring is also included in the pathway, emphasising the importance that monitoring has to adjust treatment plans and interventions. The new SIGN NICE BTS guidelines cover managing chronic asthma using pharmacological and non-pharmacological management strategies, with inhaler device selection and then strategies for improving adherence to prescribed inhalational medication. As the guidelines include Also, managing acute asthma with recommendations for managing exacerbations. Additionally, the pathway has managing difficult and severe asthma with specialist therapies and specific management issues where guidelines cover additional management during pregnancy and labour, during breastfeeding and asthma in adolescents. So I hope I've covered enough of the guidelines. I know it's very detailed and complex, but I will now briefly just touch on addressing the environmental impact of inhaler devices and the reduction of environmental harm. I know one inhaler manufacturer that is transitioning its pressurised metered dose inhalers, PMDIs, to a new low global warming potential propellant, HFO 1234Z. HFO 1234Z has a global warming potential of 99.9% lower than those used in conventional inhalers. This change of propellant for the multi-dose inhalers aims to reduce the environmental impact of respiratory medicines. And we must consider the recycling potential for the inhalers themselves also. Some are relatively easy to recycle and don't have a lot of components, but some have multiple plastic components glued, fixed and manufactured thousands of miles away before reaching the end user. While the new guidelines offer a roadmap for improved asthma care, challenges do persist. And in turning to deaths from asthma, in 2023, Scotland recorded the highest number of asthma deaths in over 30 years, a sobering reminder of asthma's potential severity. And this situation underscores the need for continued vigilance and dedication to improving asthma prevention, diagnosis, treatment and care across the country, including in NHS Dumfries and Galloway and NHS Borders. A lot to cover, Presiding Officer, and a few minutes doesn't do justice for all of the work that the expert NHS clinicians do every day to support their patients, and I thank them for that. So I look forward to hearing an update from the Minister. She's been excellent at engaging with the Lung Health Cross-Party Group and kindly provides us with much of her time at the health events, including for asthma, which I have hosted here in Parliament. This World Asthma Day is an opportunity to recommit ourselves to ensuring that everyone with asthma has access to the care, treatment and support they need to live life fully and as healthily as possible. Thank you.
Thank you, Ms Harper. We move to the open debate. I call first Maurice Golden to be followed by Claire Adamson in around 4 minutes. Mr Golden.
Thank you, Deputy Presiding Officer. And let me begin today by thanking Emma Harper for securing this debate on World Asthma Day 2025. I also want to thank Asthma and Lung UK for the incredible work they do on asthma and respiratory conditions in general. Quite rightly, they are campaigning for lung health to be treated as a national priority, and it's not hard to understand why when we look at the numbers. The motion today refers to figures from Asthma and Lung UK that around 360,000 Scots are afflicted with asthma. But a recent study published by the British Medical Journal estimates the actual number could be up to double this. And whilst manageable for many, we should not underestimate the seriousness of asthma as a condition. Since 2014, more than 1,000 Scots have died from asthma attacks, with the figures in 2023 being at their highest in more than 30 years. The thing is, many of these deaths are preventable, but only if we take the right action, such as providing the basic treatment steps outlined in today's motion. This consists of a patient action plan, education on proper inhaler technique and an annual review. It is a vital combination because asthma requires daily attention, even if someone otherwise feels well, in order to mitigate the risk of asthma attacks. So, it's deeply concerning to see what the research from Asthma and Lung UK says about this. Last year, just 30% of Scots received all three basic elements of treatment, which was slightly behind the rest of the UK at 32%. We need to see more progress being made, so it's obviously a concern that the Respiratory Care Action Plan appears to have been shelved. Perhaps we might hear from the Scottish Government today on the possibility of a new lung health strategy to allay these concerns. Just as I hope we hear more about the action on tackling air pollution. an issue that many of those with asthma readily say makes their condition worse. Common complaints include feeling breathless, wheezy and having symptoms triggered. Such is the case of one of my constituents, reported in the press, Audrey Glenn from Dundee, who has raised the impact of localised air pollution from coal fires is having on her. She sees her garden fill up with smoke, triggering coughing and forcing her to reach for her inhaler. She makes the perfectly reasonable point that house coal fires aren't suitable for built-up residential areas in this day and age. Happy to.
Emma Harper.
I thank Maurice Golden for giving way and appreciate you speaking in the debate today. Do you think that low emission zones will help contribute to cleaner air within our cities, which might help benefit people who have got asthma, especially asthma that might be triggered by poor air quality?
Always through the chair. Maurice Golden.
Thank you. I thank the member for that intervention. I think what was clear from yesterday's debate is we need the data to signify that and ensure that low emission zones as a mechanism for improving air quality needs to be verified, and we need to see the data, and it has to be an evidence-led approach on those aspects of it. One thing we could do to ensure that the data is correct is, particularly in areas such as schools, having air pollution monitors and not just focusing in specific areas in city centres. So there's a lot of work in there, but it was actually speaking about domestic coal heating, because it is a major problem in terms of air quality. However, in England, the sale of house coal was banned 2 years ago. Now, to be fair, here in Scotland, the Cleaner Air for Scotland 2 strategy proposed such a ban, but there has been little or no action from the Scottish Government to implement it. For me, it seems like an obvious move to make, and consumers and householders would not be disadvantaged, but the air quality would certainly benefit. So Scotland has some catching up to do, both on the treatment and prevention fronts, and I would urge ministers to take advice of Asthma and Lung UK and treat asthma and respiratory conditions as the national priority they are.
Thank you. I now call Claire Adamson to be followed by Carol Moch in around 4 minutes. Ms Adamson.
Thank you very much, Presiding Officer. Can I also start by thanking Emma Harper for bringing this debate to the Chamber and for her continued dedication to everything about lung health. The subject is timely. Spring season brings welcome warmer weather, but we know that the increased pollen levels can lead to flare-ups with respiratory issues, including asthma. With asthma being the most common respiratory condition affecting people of all ages, it is disappointing to hear that only 24% of people living with asthma report receiving the 3 basic checks for asthma care. That is an annual review, inhaler technique check and written action plan. So if you take one thing away from this debate, I want everyone to know that if they're living with asthma, to speak to clinicians and their GPs and frontline services about the basic checks. Asthma is a relatively well understood condition and it is common, but as Maurice Golden said, that does not mean it should be treated lightly. As this debate motion notes, 2023 saw the highest number of deaths in Scotland caused by asthma in 30 years. And that speaks to the seriousness with which we should all treat the basic checks and the importance of advocacy of the Global Initiative for Asthma and charities such as Asthma Plus Lung UK. I believe we are taking respiratory health more seriously. Air pollution is now getting much needed prominence in public policy, and air pollution has been a recurring subject at the cross-party group on accident prevention and safety awareness, which I convene, which have the privilege to convene, and we tend to raise it in the context of child safety. That is why planning proposals around schools and nurseries need to be cognisant of the particular danger that air pollution presents for children. The Chamber may remember the awful case of Ella Adu-Kissi Deborah. Ella died following an asthma attack in 2013, with an inquest later finding air pollution as a material contribution to her death in London. This was the first time in the UK that air pollution had been recognised as a factor in such deaths. The levels of nitrogen dioxide, as we hear Emma Harper talking about, near Ella's home had exceeded World Health Organization and European Union guidelines. Her mother, Rosamund, understandably could not describe her settlement as a win in this situation, given the unimaginable tragedy inflicted on her family. But it gives a stark emphasis on the importance with which policymakers, legislators should treat clean air strategies. Rosamund's sobering words after a mammoth legal saga said that the fact that in 2024 children continue to die from asthma is not acceptable. Ella's death was preventable. Indeed, according to the Global Initiative for Asthma, most of these deaths are preventable. Asthma is one of the most common chronic non-communicable diseases that affects over 260 million people and is responsible for over 450,000 deaths each year worldwide. Managing the condition and managing attacks is often a matter of basic accessibility to inhaled treatments. That brings the focus of this year's World Asthma Day theme into sharp relief. Make inhaled treatments accessible for all. Again, I thank Emma Harper and those that have contributed to the debate this afternoon, and I hope it will have gone some way to raise the importance of the management of asthma to those who will be watching the debate. Thank you, Presiding Officer.
Thank you, Ms Adamson. And I call Carol Mochan to be followed by Gillian Mackay. Around 4 minutes, Ms Mochan.
Thank you, Presiding Officer. And I also thank Emma Harper for bringing this really important debate to the Chamber. And I know that the member has great knowledge and skills in this area, and I really praise the ongoing work that she is committed to carrying out in the Parliament and I know beyond as well. Scottish Labour welcomes World Asthma Day 2025 and recognises this year's theme, as others have said, make inhaled treatments accessible for all. This, as we have heard, is so important because 2 out of 3 asthma-related deaths are preventable. We know that asthma is one of the most common chronic non-communicable diseases, and today we are reminded of its prevalence in Scotland. Whilst there is no cure, most people can control their symptoms well with asthma inhalers and other medicines, improving their overall quality of life and outcomes. And this is why this year's theme is so important. It emphasises the need to ensure all sufferers can access inhaled medication and appropriately manage the disease, which is crucial in reducing the frequency and severity of attacks. However, the Asthma and Lung UK survey found that only 30% of sufferers reported receiving all 3 basic provisions of asthma care in 2025. And this is deeply worrying, and I know everyone will be concerned about that in the Chamber, as the 3 basic elements of care ensure the disease is effectively managed and controlled and that important deaths are prevented. Now, I want to turn, if I can, to inequalities. We know that women have a far worse health outcomes for men in many cases, and in respiratory health this is no different. Women are more likely to have asthma, have more severe symptoms and are more likely to die from their asthma. Many women experience a worsening of symptoms around menstruation and are at risk of potential fatal asthma attacks every month. But there is very little research and understanding in this area. During last year's debate, I raised the point about data and the lack of an accurate collection method or an agreed reporting system across health boards in Scotland. Following on from this, I asked whether the Government would consider gathering greater data on the impact of gender and asthma outcomes to help us better understand this inequality, and perhaps the Minister might have some words that she could feed back to us in her closing remarks around this. On the data point, I also noted that in last year's debate, the Government pointed to ongoing work with Asthma and Lung UK and other key partners on commissioning a full national audit programme for respiratory conditions. I know the Minister recognised the importance of this and, as Emma Harper said, attends many of the events, and she knows that improving patient treatment outcomes is so important, so any information you have on that would be greatly received. Lastly, I would also like to raise some concerns I have around government's progress in respiratory health policy. At FMQs last week, I highlighted Chest, Heart and Stroke Scotland's concerns that the government is stagnating in its delivery of the Respiratory Care Action Plan, and I would like to take the opportunity to re-emphasise those points and urge the government to make progress on respiratory health, which often receives less attention perhaps than other conditions. There is much that we can do, and I know that the Minister will be keen to move this forward. The respiratory outcomes in Scotland remain comparatively worse to others in other European countries. So without action on this issue and raising awareness like this in the Chamber, asthma and respiratory health will continue to remain a persistent public health problem. And I know that's not what anybody in this Chamber would like. So working together, I think, is really important. And again, I really thank Emma Harper for bringing this to the Chamber.
Thank you, Ms Mochan. And I call Gillian Mackay to be followed by Alexander Stewart. Around 4 minutes. Ms Mackay.
Thank you, Presiding Officer. I also wish to thank Emma Harper for securing this important debate to recognise World Asthma Day, which takes place on the 6th of May. I wish to echo the contents of her speech and recognise the importance of the point she, along with many other colleagues, have made. Despite being considered a relatively common condition, asthma can be hugely debilitating and life-limiting for some. The impact it has on being able to exercise, as well as the mental load of being on a constant watch for what triggers your asthma, or avoiding areas which are particularly polluted or have strong smells, is hugely important that we highlight the challenges of everyday life for those with asthma. As Emma Harper and Maurice Golden highlighted, the number of deaths that have been recorded in Scotland in the last few years does show how serious the condition can be. To break their particular deadlock and the impact of LEZs on health issues, I will forward a study from the University of York from 2022 to colleagues that says, and I quote, LEZs decrease the probability of having health problems that limits activity by 1.2%. Compared to the baseline mean, this corresponds to a 7% reduction. This did relate to LEZs in England, but it was a very quick search. The theme for 2025, Make Inhaled Treatments Accessible for All, as we've heard, is a strong reminder that getting the right medication should never be a luxury. Inhaled treatments are vital for managing asthma every day and for reacting quickly to dangerous attacks. Too many people still face obstacles from limited availability to prescribing issues and misdiagnosis or follow-up care. This is especially the case where lung conditions kill more people in the UK than anywhere else in Western Europe. In Scotland, this tends to affect the most deprived households disproportionately. An estimated 2.3% of the population registered with a GP had a diagnosis of asthma, or roughly 360,000 people, and serves as a reminder for why it's important for us to double down on our efforts to raise awareness. Several organisations such as Chest, Heart and Stroke Scotland and Asthma Lung UK have been in touch with valuable data and pressing concerns, and I wish to briefly highlight some of the urgent actions that they wish to see. In 2021, the Scottish Government published its Respiratory Care Action Plan with a vision to improve the prevention, diagnosis, treatment and support for people with asthma and other respiratory conditions. As we've heard, the plan included 12 commitments with a particular focus on the transition from child to adult services, better access to pulmonary rehabilitation and improvements in respiratory data. 4 years on, a lot of the progress has been slow. This isn't to say that there haven't been some positive developments, such as restrictions on tobacco and vapes and steps to improve care for young people moving into adult services. However, the implementation has undeniably stalled. And crucially, we now face the loss of clinical leadership in this area. Without specialist leadership, it will be much harder to make progress on vital areas like data collection and pulmonary rehab. Moreover, the Centre for Sustainable Delivery has developed a plan, but implementation is on hold because of unresolved funding. We must not lose sight of the importance of properly funded research as well, and services that lead to better treatments and wider access for everyone. I have, in previous World Asthma Day debates, raised the issue of the environmental impact of inhalers. Many inhalers, particularly older types, use propellants that contribute to increased emissions. And like Emma Harper, I was encouraged to see the innovation that is coming in this space. The new medicines that we're seeing is likely to launch soon. Some of them are COPD treatments, but do have applicable transfers into asthma care as well. These mark a major step towards reducing the environmental impact of inhaled medicines, whilst still ensuring patients, especially the most vulnerable, get the treatments they need. Allowing choice for the patient is hugely important. Not everyone wants to or are able to use a powder inhaler, for example. Some will have used a conventional inhaler for a long time, and encouraging companies to look at the environmental impact of their medicines is in everyone's interests. It is essential to recognise the ongoing challenges faced by those living with asthma. More investment in research and better support for innovative treatments are crucial to improving lives. It's time to commit to stronger action to protect the health of those affected and invest in a healthier future.
Thank you very much. And we now call the final speaker in the open debate, Alexander Stewart. Again, around 4 minutes, please.
Thank you, Presiding Officer. I'd like to thank Emma Harper, as my fellow co-convener of the cross-party group on lung health, for bringing this important debate to the Chamber today. And as the debate motion states, the theme for this year's World Asthma Day, which takes place on the 6th of May, as we've heard, is Make Inhaled Treatments Accessible to All. The asthma charity themselves have long been calling for that, Presiding Officer. They encourage the use of preventer inhalers, and everyone who has asthma emphasises the importance of prevention, airways inflaming and the risk of asthma attacks. They also promote alternative inhalers, which appear to be safer and more effective than the traditional blue ones we've had in the past. And if we take a look at the detail that's been recommended, it becomes apparent that's why the recommendations make such good sense. Asthma Lung in UK highlight the very evidence that they have that prevention is so important, and the managing of the inflammation and reduces the risk of asthma attacks. We've heard today about the difficulties that individuals have and the air quality they have to manage, but to advocate the moving away from common blue inhalers and the fact for air or MART inhalers really has a real benefit to the individual. The importance of the correct inhaler technique cannot be stressed enough either, Presiding Officer. It's vital to ensure that the medication reaches the user's airways correctly and provides the most benefit. And we've heard from patients and consultants and individuals within the profession that is the techniques that are required to be supported. And I have within my own region across Mid-Scotland and Fife, BZZ, Clackmannanshire, and in Fife itself we've got BZZ Dunfermline, Glenrothes, Leven and Kirkcaldy, and they all are there to support individuals who have asthma or CPOD, and they also offer support and encouragement for coaching when it comes to use of using inhalers and making sure that they're being effective. And whilst this is very important, it's also essential that the access is discussed, because access still is a problem. The subject has been brought up time and time again in the cross-party group and has also been discussed with patients and health professionals, and we've also had the Minister for Health Minister there to discuss that. So, however, there are still struggling individuals to obtain the basic treatments within some parts of the region, and that's vitally important. We've heard today also about Pheno, which has been discussed, and I think that that's an area that needs to be looked at and progressed. And I look forward to hearing where and what is being consulted on. I strongly agree with many of the recommendations that are coming forward. The Scottish Government must have a basic duty of care to ensure that pathways are available for everybody. We've touched on the pathways before, but not all areas of Scotland have the same pathway as it's been reported, and I think that's vitally important. We've talked about today that in 2023 we saw the highest number of asthma deaths recorded in Scotland for over 30 years. Now that is a major issue, and we've talked about air quality, we've talked about people's living conditions and the whole attitude that we have, but there needs to be some clarity as to how we're managing that across many of our locations and regions. So clearly something must be done that ensures that this matter is urgently tackled, and I look forward to hearing from and acknowledging the positive work that the Government has attempted to do from the Minister when she sums up. But there are still, as I've said before, many areas that we still require to progress, and I look forward as I say, to hearing from the Minister. But the cross-party group has been doing exceptional work. And as I say, I once again pay tribute to my co-convener Emma Harper and Asthma Lung UK, because we are challenging this on a regular basis and we continue to move things forward. And that has been really quite inspirational to meet and discuss with clinicians and professionals and individuals who suffer. They come and they tell us the real world that they're living in on a day-to-day basis. So it's vitally important that we take on board all their concerns. And as I say, I look forward to hearing what the Minister has to say in her summing up. Thank you.
Thank you, Mr Stewart. And I now invite Jenny Minto to respond to the debate. Minister, around 7 minutes.
Thank you, Presiding Officer. I too would like to thank Emma Harper for lodging this important motion and welcome the opportunity to respond on behalf of the Scottish Government. I'd also like to put on record my thanks to those supporting people living with asthma in Scotland, including NHS staff and third sector organisations such as Asthma Lung UK, and also recognise the important work as a polite agitator, perhaps I would describe it as of the cross-party group chaired by Emma Harper and Alexander Stewart, and I'm always very pleased to attend meetings that you hold. I think this has been a valuable debate, and I thank everybody who has contributed for the absolute, I think, recognition across all parties that we share the same desire and awareness, and to share the desire to raise awareness of asthma and ensure that people who live with it receive the best possible care. Last night, I was pleased to be able to join a round table on interstitial lung disease, which was hosted by Colin Smith. And one of the members attending that reminded me and everyone in the room of the importance of listening to those living with respiratory conditions when shaping policy. And certainly I know members have commented on that in this afternoon's debate. And although not directly a cardiovascular disease, asthma can increase the risk of developing them. And yesterday I had a conversation with the Chief Medical Officer who had hosted a webinar for about 1,000 GPs specifically on respiratory disease. So there is constantly in the background a lot of work going on. If I may just touch on a couple of the points that have been raised, both by Emma Harper and Maurice Golden and others. They are right. The statistics on asthma deaths are alarming, and that was actually the preemption to my conversation yesterday with the Chief Medical Officer. The Scottish Government is absolutely committed to preventing avoidable harm, and I thank members for continuing to highlight the risks. We know that most people with asthma are treated by their GP or practice nurse, and we've committed to a greater proportion of new NHS funding to primary and community care so that GPs and services in the community will have the resources they need for their essential role in managing conditions like asthma. Maurice Golden and also Carol Mochan both raised the RCAP, and we continue to support a number of projects via NHS partners. And so the RCAP is still being supported. However, I'm sure as members are aware across the Chamber, we are currently consulting on a long-term conditions framework which runs until the 20th of July. And as I said last night, I see that framework as being very similar to the cancer framework that we have, where we've got common areas across different cancers that are kind of joined, but also we have specific strands of work for outcomes on specific cancers. So I would encourage everybody living with asthma to respond so that the perspectives of people with respiratory conditions are properly reflected in that consultation. Carol Mochan correctly raised the point about the importance of data. And in 2023, as she will know, the Scottish Government provided Public Health Scotland with funding to undertake a scoping exercise to develop a respiratory audit. And I absolutely recognise the importance of that meaningful data. So we are currently considering the best way forward with that work. World Asthma Day allows us time to reflect on the progress made in respiratory care, as well as the challenges we face. We know that the care and treatment for asthma is not always where it needs to be. This is reflected in the concerning statistics on asthma deaths last year, as many have mentioned. The Scottish Government is committed to improving services across the country to meet their needs through the implementation of the Respiratory Care Action Plan. The theme of this year's World Asthma Day, as many have said, is Make Inhaled Treatments Accessible for All. We know that around 360,000 people in Scotland currently have a diagnosis of asthma, and that it is the most common respiratory condition impacting people of all ages. And most people living with asthma are supported well by their GP and practice nurse. However, we do recognise that there is a way to go to ensure that everyone gets the care they need at all stages of their life. And this too was highlighted in the discussion last night at the round table. And we were reminded by Emily Kennedy of the Royal Pharmaceutical Society of the support community pharmacies can also provide. A major milestone in asthma care over the last year has been the publication of new guideline on asthma diagnosis, monitoring and management, as Emma Harper has laid out. This guidance was a collaboration between the British Thoracic Society, NICE and SIGN, and signals a shift in asthma care. It aims to improve the accuracy of diagnosis, help people to control their asthma and reduce their risk of asthma attacks. We know that a key area for improvement is diagnosis of asthma, and this guideline recommends a change in investigations to simplify the diagnostic pathway. And as Alexander Stewart mentioned, changes include using FeNO breath tests and blood investigations alongside the traditional tests, such as spirometry and peak flow measurements. We hope this directs us towards standardised, evidence-based care that will improve outcomes for everyone living with asthma. We will now work with key stakeholders across health and social care to ensure these guidelines can become a reality for clinical professions and those living with asthma. A key part of this will be continuing to promote the Quality Prescribing Guide for Improvement in Respiratory Conditions, which was published last year. And this guide aims to keep people at the centre of their treatment and promote safe, evidence-based, sustainable prescribing, and it highlights the importance of people with asthma having access to their own personalised asthma action plans tailored to their individual needs. The guide also highlights that each person should receive training on how to use their inhalers properly, as Emma Harper mentioned. We understand that for those living with asthma and other conditions, that environmental factors play a huge role in their daily lives, as Claire Adamson laid out so well in referencing the sad death of Ella in London. Our vision is for Scotland to have the cleanest air in Europe, and we are committed to protecting people from the effects and harms of poor air quality. For example, the introduction of low-emission zones in our 4 largest cities from 2022 was a key initiative in further improving urban air quality. And I note the point that a number of members made about air pollution monitors in other locations, and I will speak to colleagues in government with regards to that. Scotland also has a range of world-leading tobacco control measures, as Gillian Mackay noted. We are committed to creating a tobacco-free Scotland by 2034 and welcome the reintroduction of the UK-wide tobacco and vapes bill that will help us to achieve our ambitious target as smoking rates continue to decline. This suite of prevention measures will help people to better manage their condition, but also support us to prevent respiratory disease in future generations. Presiding Officer, I would like to close by reiterating our commitment to ensuring that everyone living with asthma in Scotland receives the best possible treatment, care and support. We know that there's still more to do in respiratory care, and we can improve by better understanding the needs of people living with asthma, as I was so eloquently reminded last night. Thank you.
Thank you, Minister. That concludes the debate, and I suspend this meeting of Parliament until 2:30.